Many of you have heard the term precision medicine in the news. How are cancers currently treated? Today, the standard cancer treatments are surgery, radiation, and chemotherapy. Now, these treatments are empirically based on the tissue of origin, what the cancer cells look like under the microscope, and how far the cancer has spread. However, such treatments do not consider the molecular changes in the tumor, and so many patients either receive needlessly harsh treatments or are undertreated and die. The first approach for individualized treatment is to look for gene markers. This is called molecular profiling or molecular signatures, and when one finds these markers or signatures in tumors, they may be used to predict the likelihood of recurrence in breast cancer patients. The test divides patients into 3 equal groups. A third of the patients are put into the recurrence unlikely group, who would most benefit from just surgery, a third into an indeterminate group, and a third into the likely recurrence group, who would most benefit from both surgery and chemotherapy. The second approach to individualized treatment is based on sequencing DNA. In the last few years, there has been development of what's called next-generation sequencing, which allows scientists and physicians to completely sequence the DNA in a tumor. This is used to identify mutations or copy changes in a few cancer genes to guide therapy choices. Now, this approach looks for what is different in the tumor on a molecular level, and treatment decisions depend on molecular changes in the tumor instead of tissue of origin. For example, extra copies of the HER2 gene are found in about a third of breast cancers, and such tumors are responsive to the drug Herceptin. The same genetic change is also found in less than 5% of colorectal tumors, and those are precisely the patients who stand to benefit from a drug originally developed for breast cancer.